Greetings to the all audience. I am Ahsanullah and I am here to present a paper entitled Determination of Enzyme Q10 Level in Pakistani Female Patients with Breast Cancer. Let's start. Here are the contents which will be discussed in detail one by one. Abstract, background, aim of the study, result and conclusion. Aim and objective. To determine the level of CoQ10 in biological samples of breast cancer patients, to analyze and compare the CoQ10 and level of cancer patients with healthy women. Let us start abstract. Coenzyme is a nutrient like fat substance usually found in the heart, liver, kidney, and pancreas. Breast cancer is the most well known tumor that has been analyzed, and its incidence has been found to increase with age. To determine the level of CoQ10 in female patients with breast cancer, 40 blood samples from female patients with different stages of breast cancer were collected from various breast care clinics in Sindh province of Pakistan. So these samples were analyzed using HPLC with diode detection, and the result shows that CoQ10 level in the patients with stage T2 breast cancer in the age range of 29 to 61 years were 0.29 to 0.36 microgram per ml. The patient with stage T3 breast cancer in the age range of 25 to 65 years showed CoQ10 level of 0.13 to 0.19 microgram per ml. While the patients with stage T4 breast cancer in the age range of 28 to 73 years exhibited of CoQ10 level of 0.09 to 0.16 microgram per ml. The CoQ10 level in the control samples were in the range of 0.26 to 0.73 microgram per ml. So it was observed that the stage of cancer progresses, the CoQ10 level decreases. So this remarkable reduction may be a result of chemotherapy treatment given to the patients, their diet and socioeconomic status. Aim and objective. To determine the level of CoQ10 in biological samples of breast cancer patient, to analyze and compare the CoQ10 and level of cancer patient with healthy women. Let's start background. A coenzyme is a nutrient-like fat substance usually found in the heart, liver, kidney, and pancreas. As I already discussed in previous slide, so the breast cancer is the most well-known tumor that has been analyzed, and its incidence has been found to increase with age. And during many diseases of CoQ10 is taken up in large doses by all tissue, including breast, heart, and brain disease. CoQ10 is known to be highly concentrated in the heart muscle cells due to high energy requirement of these type of cells. The chromatographic separation of CoQ10 was carried out by following the reported method, and 6 different concentrations of were analyzed in the range of 0.01 to 10 microgram per ml by HPLC with a diode array detector instrument. Sample collection. All samples were collected from stage 2 to 4 from breast cancer patients. However, the sample of first stage patients were not registered in reported hospital due to the lack of knowledge, awareness, or ignorance of the disease. So that's why we have collected the samples from stage 2 to 4 patients having breast cancer. All measurements were carried out by using HPLC chromatography. The completed sample digestion was carried out by means of PL microwave oven, which was adjustable for microwave power from 100 to 900 voltage. and analyzed 700 film atomic absorption spectrophotometer fitted out with pyrocoated graphite tube with a combined platform, film burner, and graphite furnace. HGF 400 and auto sample S800 were used. COQ10 is analyzed in control female through HPLC data regarding its representative peak, where obtained at same retention time at 0.20 minutes. And figure shows that the representative HPLC chromatograph of COQ10 in control are healthy females, and the figure shows that the UV spectra of COQ10 at wavelength of 274 nm. However, the 15 different samples were collected from control healthy women and age range of 26 to 69 years. So each sample was analyzed in triplet, and this table shows that the COQ10 was calculated in the range from 0.26 to 0.73 microgram per ml. So it was observed that the amount of COQ10 was decreased as the age increases in the control females. So, however, the required standard range of COQ10 is 0.4 to 1.73 microgram per ml. And this graph shows the different concentration of COQ10 in 15 controls movements in the range of 0.26 to 0.73 microgram. The required range of COQ10 was 0.4 to 1.5 microgram. So it was determined that the control movements are lies in the required range, but 2 to 3 movements show low level of COQ10 in the age from 26 to 69 years. And about 45 different samples were collected from patients according to the three stages of breast cancer, and the age range was 25 to 65 years, and each stage contained 15 number of samples. So each samples were analyzed in triplicate by HPLC and diode array detector, and this figure shows that the representative chromatogram for the separation of COQ10 from plasma of breast cancer patients. And this below figure B uh, was the UV spectra of COQ10 at wavelength of 275 nm. And this table uh, show the quantitative analysis of COQ10 in three different stages of breast patients. And this graph shows the different concentration of COQ10 in T2 stage of 15 breast cancer patients in the range of 0.28 to 0.36 microgram per ml. The required range is 0.4 to, as I already discussed, that the required range is 0.4 to 1.5 microgram per ml. So it was calculated that the low level of COQ10 was analyzed in T2 stage of breast cancer. And this graphical result of COQ10 in T2 breast cancer patients, it was observed that the decrease as age increase, the amount of COQ10 was calculated range of 0.09 to 0.36 microgram per ml. So the observed value of COQ10 was lower as compared to the required range. So the required range or reference range, I already discussed that COQ10 in humans is 0.42. The graph shows various concentration of COQ10 in T3 of breast cancer patients in the range of 0.09 to 0.19 microgram per ml. It was determined that the low level of COQ10 was analyzed in T3 stage as compared to T2 stage of breast cancer. And this graph shows different concentration of COQ10 in T4 stage of 15 breast cancer patient in the range of 0.11 to 0.16 microgram per ml. It was calculated that low level of COQ10 was analyzed in T4 then other T2 and T3 stage of breast cancer patient. And the chromatographic separation of CoQ10 was carried out by following reported method, and six different concentration of CoQ10 were analyzed in the range of 0.01 to 10 microgram per ml by HPLC, and the separation of CoQ10 was done at a retention time of 8.2 minutes at flow rate of 1 ml minute. And this figure chromatograph of shift differential with good resolution and sharp sorry, symmetrical peaks in this study. So the CoQ10 was further confirmed by studying the UV spectra at wavelength of 274 nm. The calibration is a process of centrifugation an instrument to provide a result for a sample within an acceptable range, and eliminating or minimizing factors that cause inaccurate measurement is a fundamental aspect of instrumental design. So the calibration of CoQ10 was carried out from lower to higher range at six different concentration. Uh, 0.01 to 10 microgram, and the linear relationship between the concentration and the area of peak was obtained with regression coefficient of 0.999. The Pearson correlation measure the strength of the linear relationship between the two variable, and it has a value between -1 to 1, with a value -1 meaning a total negative linear correlation, and 0 being no correlation, and +1 meaning a total positive correlation. So linear regression and Pearson coefficient of CoQ10 in blood samples of reference versus different types of female breast cancer patient. The screening mammography is a specific type of breast imaging that use a low dose X-rays to detect cancer early, before women experience symptoms. When it is the most treatable, the mammography is a reference exam for screening and diagnosis of breast cancer. So it presents sensibility of 40 to 73 percentage and a specificity of 94 percentage, that is highly dependent on the breast density. For this study, all clinical data and relevant details of each participant was registered by filling pro forma and questionnaire, and verbal and written consent was taken from all participants and explaining them about the study purpose. The conclusion of this study: the blood sample were collected from breast cancer patients of three different stages in the age range of 25 to 73 years, and samples of non-affected females were also collected in the age range of 25 to 69 years. After analyzing the blood sample of affected and non-affected female, it is concluded that the amount of CoQ10 was found higher, 0.36 microgram per ml in the range in the age of 29 years, while the lower amount was observed 0.09 microgram per ml in the affected females in the age of 65 years. Thank you for your attention.